there's a lot up in the air about, we don't know if we're going to have classes in public schools or Garces this fall. We don't know if there's going to be fall sports. And as soon as things started to look better, we have had a surge of coronavirus cases to the extent that local officials are worried that we may be pushing the parameters under which we operate from the state that have allowed us to move as quickly as we can. Now, all of this was predicted. We didn't want to hear it, but my next guest has been talking about the danger of a second wave, the danger of potential third wave, the danger of what could happen if we don't continue in the right spots to practice some degree of social distancing and wearing our masks. I'm talking about our Friday guest, used to be our Wednesday guest. We've moved him to Friday, is Dr. Bridge Bomby. He's the founder of Centric Health, a local cardiologist in town, a man who has been able to walk us through this coronavirus in a way to make sense of it in a medically and scientific way in which certainly I could not, or other hosts who are not speaking from that experience. Dr. Bridge Bomby, welcome to the Richard Bean Show, sir.
Hi, Richard. How are you? Thank you.
I'm doing terrific. I have to ask you this, Dr. Bomby. Did it come as any surprise when you're watching these numbers spike? Multiple days in a row to the point where we're worried about being in conflict or in violation of the parameters in which the state set out for allow us to move forward? Did it surprise you?
So there are two aspects. One is the spread of the virus. And the spread of the virus, if encouraged in a contained manner and limiting it to the people who can deal with the virus better, and cordoning of the sick and the elderly population, it would be a reasonable strategy. How do we measure and manage that is through hospital admissions. So yes, the number of infections are expected to rise as there is a more mobility among the people. The downside has to be measured through increase in hospitalizations and ICU admissions. The part that I don't like, let's say I'm a little worried about, is that the hospitalizations have been increasing at a rather rapid clip. We are not in any way in danger of hitting the peak or maximizing our capacities, but the numbers have increased substantially in multiple states, including in our own Kern County. For instance, in Phoenix, there is a hospital system called the Banner Healthcare, which is a large system, and their numbers have gone up by 90%.
90%?
89 to be precise.
Wow.
Hospitalizations, and across the state, for instance, in Texas, the numbers are increasing substantially. In Houston, they're up 34%. The hospitalizations I'm talking about. So the metric that we need to be careful about isn't the number of infections, but the number of hospitalizations, because that's where the crunch comes in. That's where the virus can be most deadly in increased mortality if we maximize our hospital occupancy and we can't take care of the sick.
Right. Do you know where we are? That we've never even come near full capacity on using up all the beds for coronavirus cases, have we? How close are we to, or are we close at all, or are we just trending that way to maxing out our capacity?
I don't think we are even near the 50% of our available capacity. Our capacity is pretty large here. So I don't expect that the Kern County endogenously is ever going to have an overwhelming number. But I think we may be used as a spare capacity for surges in other communities.
I got it. When you talked about it's, and I understand intellectually, I think that it's okay. Infections are okay as we move toward kind of herd immunity as long as they're in the right demographic. Did I say that correctly?
Yes, sir.
Okay, all right. So as long as we can keep it generally among the younger and healthier people and keep it out of people with pre-existing conditions or which would make them more susceptible to a bad case or the elderly, that would be okay. But that's hard to do, isn't it?
Yes. So it's a good theoretical possibility, but implementation at a larger scale is fraught with hazards for multiple reasons. The first one is the adoptability. How many people will adopt the mask, the distancing, the hygiene? Some people more than others. Then, how are we going to actually segment and shield the elderly and the sick? So the problem, Richard, is that in this country, under the age of 65, at least 60% of the people have one comorbidity. 40% have two comorbidities. So you're not talking about an incredibly healthy population, even in a younger age group. So when you talk about protecting, how much risk are we going to take as a nation? The reason I keep supporting the herd immunity is there is no other way out. The alternatives are countries like New Zealand or Australia to a degree or Iceland, which they have cordoned off the virus. But the susceptibility is there. The cocoon is a relative safety because the virus persists and the population is in danger. The only time you have a relatively permanent cure is the exposure to the virus or the vaccine. Now, the vaccine is riding on hope, but a lot of people I talk to don't have that degree of faith that we're going to have an effective and durable virus that will be adopted by majority of the country. And the rationale for that is that about 30% of the people in this country don't like to be vaccinated, and that takes a huge segment out. And then when we rush to make a virus, when we rush to make a vaccine, which may have deficiencies, side effects, or other things, that will give the people who don't like vaccine a loud voice. Did we not tell you so?
Right.
So I worry about rushing a vaccine which is somewhat deficient or not effective or has side effects. So given the alternative, a herd immunity option, even though fraught with hazards, is more appealing.
Oh, that's interesting. You said, I want to make sure I heard you right because that was stunning. 30%, 30, of the U.S. population does not believe in vaccinations?
Yeah, those are the numbers I have read.
That is stunning to me. That is stunning to me. When you said earlier, Dr. Bombi, you were talking to Dr. Bridge Bombi of Centric Health, when you said earlier about that we don't have a particularly healthy younger population, what are some of the factors that lead to that?
Richard, it all started in 1950s when the fast food culture began, from Kentucky Fried to McDonald's to Burger King and others. In those days, in 1950s, a hamburger was 3.9 ounces, a patty. Now we're up to 16 ounces. So what has happened is the hunger for easy and fast food has been the anchor for obesity and all the acquired behavior-related diseases that include high blood pressure, diabetes, coronary artery disease. Our morbidity, our obesity rate was 12% in 1950. Now you're talking morbid obesity more than 30 and overweight more than 60%. So what happened is we are packing dense calories, which are nutritionally vacuous, but they are cheap. So the corporate America has created an addiction for a food which is rich in salt, grease, and sugar. It's very palatable, very tasty, and very expensive from a public health care standpoint.
Lord, that's so true. Salt, grease and sugar. I mean, that sounds like Southern cooking, if you ask me. Well, it's so true. And what percentage of our population, of our younger population, did you include one there, is now either obese or morbidly obese? Do we know?
Those are the same numbers. So 30%
Okay.
morbidly obese, 60% more so in Kern County, but 60% overweight. And the problem is it's more so in children. It's not less so.
Yeah. Dr. Palme, I had mentioned to you earlier that in some of my chats with friends, I'm running into this idea a lot. People are saying, here we are 3 months or whatever into this. It's popular to have to feel like, well, this wasn't such a big deal after all. I don't know anybody had it. I was with somebody last night, Dr. Bambu, who said, "Oh, I know women in their 80s and 90s who didn't affect them at all. They had their bridge groups." The idea is that this thing had been hyped, that somehow we got it wrong, and that they're justifying their own sense of lack of social distancing, whatever. Do you hear that a lot? And how, if somebody told that to you, what would your response be?
I'll let the facts do the talking. The facts are we have 98% or somewhere that number. Most of the U.S. population is susceptible to the virus. Most of us haven't had the virus yet, and we have 113,000 deaths. So that's a cumulative number that exceeds more than 3 years of flu deaths. And we have been able to keep the number under covers because of lockdown and flattening. Now, as we relax, the numbers are going to go up again. And if this thing rides along with flu in this coming fall and winter, then we are in for a really bad winter. This virus is much worse than flu. The numbers speak for themselves. This virus listens to the safety measures, masks, hygiene, and distancing. So if we approach it, if we manage this virus, we can coexist and achieve the nirvana of the herd immunity. But if we go out of our way to sound like we're invincible and quarantine fatigue is showing, we're going to invite disaster. There is no way around it. What happens, Richard, is young person maybe you could say relatively immune to the bad consequences of the virus. But the virus, they carry a caravan of stowaways. The virus is there in their body, and they use that as a conduit to disseminate to others. We all have to assume that we are asymptomatic carriers, and we can infect the people who really can't, who don't have our immune system to deal with it. So wearing a mask is a charitable act towards the people who are more likely to have adverse consequences. This virus is real. This virus has killed way more than a flu season will, and most of us retain the vulnerability. Nothing has changed. Yeah. Nothing has changed other than the fact we understand it better, and if we don't adopt those practices to avoid the severity of infection, or don't practice the measures that increase the spread in an exponential manner, then we are asking for trouble.
Yeah, absolutely. Dr. Bridge Bombi, everybody. Dr. Bombi, let me ask you this. If JR and I were talking earlier about these spike in local cases, now, are we seeing yet, and the follow-up would be, if we're not, when would we see it? All of these protests across the country where we saw people cheek to jowl, right next to each other, yelling, spitting, I mean, everything you do when you're emotional and you're protesting, getting close, touching each other. When would we start to see the spikes or the increase in cases from all of these protests across the country? How long does it take from, because I believe George Floyd was killed, I want to say 3 weeks ago or almost 3 weeks ago. When would we start seeing those cases?
I think 2 to 4 weeks is a good guess. So we should start seeing the next week on. We should see a jump related to that. And again, virus is an equal opportunity omnivore. It's agnostic to ideologies, political proclivities, and belief systems. It's agnostic to righteousness of congregations. So I don't care what is the underlying passion that invites the crowds. Understand it. Virus is out there and it's liking that behavior.
So it is the virus is agnostic. I love that. That's a good thought there. Final question for you. I think we had talked about this earlier a couple of weeks ago, but it refreshed my memory here. Once again, I'm with somebody last night who says, I think I had this virus in January. I had a persistent cough. I coughed once for a full hour. I had a fever. Yeah, and he said, I remember thinking this is the worst flu I have ever had. It lasted a few days, particularly at night. He got this incredible cough he couldn't stop. In a general sense, does that sound like something that could have been COVID-19? And does the timeline of mid-January or so, do you believe it was around then?
That's not consistent with the timeline. So there are a lot of people who believe, and their belief system cannot be shaken by the facts that they had the virus. The answer is no, they did not. They did not. Nobody had the virus in January in Bakersfield, guaranteed. But it's hard to believe that because there's a bit of magical thinking in that, so somehow I'm immune. So a lot of people are looking for antibody testing, which is flawed, as we have talked many times. So far it is flawed. But the prevalence of infection or the cumulative prevalence of infection in Bakersfield isn't more than 1 or 2%.
Okay, all right.
If that.
All right. I think you're right, because he brought that up, kind of wishful thinking. Well, maybe I should be tested for antibodies because I guarantee I've already had it. So to him, that's giving him some degree of immunity, however small, in his mind, that if he had that. And I've heard that a lot, people thinking, well, January was a bad month for a lot of people. We must have had the virus. Apparently not. Okay. 2:24, we've run out of time. Dr. Bridgebomby, always a pleasure to have you on, sir. I hope you have a great weekend.
You too, Richard. Thank you very much.
Okay. Thank you so much. It is.